Alrighty. My name's Austin Bolden. I'm in the Colloquium 2993 class, and I'm here interviewing Mrs. Beth Boyett today. And yeah, just go ahead and tell them a little bit about yourself.
Yes, so I'm a clinical dietitian. I work at an acute care trauma center. So I'm in the healthcare field, of course, at an acute care hospital. But we're a level 1 trauma center in Macon, and we see all different types of patients, just a little bit of everything. So with my job, I get to see patients when they're on the ventilator. I get to feed them enterally with tube feeding, or sometimes if their gut's not working, we get to do IV nutrition. So.
Oh wow.
Yeah.
So, which would you say is what is an average day looking like? If even there is an average day.
Yeah.
Yeah.
Typical day. So, first off, let's start with like how we see our patients. So, we screen our patients, but also nursing screens our patients. So, nursing has that huge history form that they fill out on everybody when they come to the hospital. But they have 2 nutrition questions that they have to ask. So they have to ask, have you lost any weight recently, and have you had a poor appetite? So depending on how the patient answers those questions, then if the patient answers yes, they've lost weight, then they ask them how much weight, and that gives them what we call a malnutrition score. So it's basically a national malnutrition screen that usually is the same at every hospital, but it gives you a malnutrition score. So if that score is 2 or above, then we get a consult for those patients.
Okay.
We see those patients. And then we get consults from physicians about if they want tube feeding on a patient, if they want TPN, which is IV nutrition on a patient. We get consults for poor appetite, suspected malnutrition, a little bit of everything. And then we, as dietitians, are also looking through our patient lists every day for, people who have wounds, or people that have other conditions that we're looking for. Like if their body mass index is under 18, then we see those patients as well. So there's kind of no typical day, but on a typical day, I would see anywhere from 12 to 15 patients a day. It just depends. Some days are better than others as far as consults go, and you get to do more follow-ups on your patients. And then we set our follow-ups as far as like what's going on with the patient, how often you need to see them. When you started tube feeding, you need to follow up on them sooner, like every couple of days, to make sure that they're tolerating it. Same thing with TPN. You need to make sure that everything's going okay, make sure their electrolytes are good. So it just depends on what's going on with the patients. I cover the neurological floor, so I cover the neuro and neurosurgical ICU, along with the step-down unit for the ICUs. And then I cover 2 stroke floors. So I see a lot of head injuries, strokes, a lot of people that come in for brain bleeds that have to have surgery, those type things. But I also, we work weekends as well, because we're, hospitals never close. So I also get to, on the weekend, see a little bit of everything else that everybody else does. And when I'm covering we do, at the hospital where I work, we do cross coverage, like standard cross coverage, like I cover for a specific person when they're off.
Okay.
So I get to see a little bit of everything that way, and then weekends as well. So it just depends on the day.
A little bit of everything.
Which is good.
Yeah.
Keeps my skills, up to date and active. In addition to, with my job, I'm also required to do continuing education to maintain my license. So there's that, but it's like real life, seeing a little bit of everything is always helpful.
Oh yeah. So I do have a question about what you were talking about earlier. What would a deciding factor be between tube feeding and the IV?
So with tube, we always like to, if one of our catchphrases as dietitians is, if the gut works, use it. So we always prefer to do tube feeding because that's going directly into the gut. It helps maintain your gut flora. Everything is flowing like it should. When you do IV nutrition, you basically cut off that, like nothing is going through the gut other than what your, what your stomach and what your pancreas and your are producing.
Mm-hmm.
Nothing else is going through. So it kind of, if you're on it for long enough, it shuts off that natural, like when your brain tells your stomach that you're full, it kind of makes that go dormant. So like, and also makes your gut go dormant. So you have to basically what we call wait for your gut to wake back up if you have to do IV nutrition. But usually we don't do IV nutrition unless someone comes in and they've either had injury to their gut, so like they were in a car accident and had an abdominal injury and you can't use the gut because they just had surgery, or they have a blockage, something like that. So that's mainly the deciding factor on when to use IV nutrition versus when to use enteral nutrition.
Do you see a plain as day difference between someone who's needing care that is older and someone who's needing care just physically, mentally, pretty much everything? I mean, obviously physically, I would assume.
Yeah.
But...
as far as the care that I provide, not really. It's probably more in the like in the physical therapy and occupational therapy, that people who are younger bounce back quicker, versus people who are older may, when, like, if you were to break your hip, your recovery would look a lot different even than mine, and there's only like a 30-year difference. So imagine somebody who's 20 years past that, somebody who's in their 70s is gonna look a lot different than somebody who's 25, 30, only because your system has been around longer, so, and your bones have been around longer, so depending on, and it also depends on what conditions that person has going in. I mean, I've seen 35-year-old patients that don't heal as well as a 70-year-old patient because that 35-year-old patient has had diabetes, hypertension, whereas the 70-year-old patient has been, like, runs marathons, or, like, has been living, a healthy life, eating cleanly, not eating anything processed. So it kind of depends on, how the person came in to it.
That makes a lot of sense.
Yeah.
It makes a lot of sense, not only considering the fact that obviously, like you said, if somebody's 70 years old, that's 70 years of their bones have been working, everything in their system has been working. And then if you take somebody that's 20 years old, and like you said, even if they've had things that have been going on through their life, it depends on how you treat yourself.
Yep, it is a lot about how you treat your body. So if you've been, like if you've been into sports, if and you've been working out and keeping your body in shape, if you've been eating well, that makes a difference versus somebody who hasn't been doing that and possibly, potentially has been doing drugs or not treating their body well. It makes a big difference. It does. It makes a big difference.
I believe it. So for because you said, and I mean, I don't want to take anything out of context, but 12 to 15 people that you would see, that's a lot of people.
It is a lot of people.
In a day.
Yeah. But not all those people are going to be, full assessments take longer. Follow-ups, if it's, a follow-up where I'm checking to see if they're tolerating tube feeding, that doesn't take a lot of time. So it kind of depends on what type of notes I'm doing. Now, if I have to see 12 full assessments in a day, that's like, I'm going to come home and be like, my brain is tired. But if I have, like 2 assessments and 10 follow-ups, that's different. So it just depends kind of on
what you're doing with the specific person.
Yep.
Cool. I'm trying to think of another good question without looking at the phone. But I think I might have to. But that's interesting that so the tube feeding, that would be for what situation? Like, why? Obviously, we talked about how the IV, you're going to resort to that if there's been some sort of trauma or something's not working.
Yeah, so if someone is, let's say that someone had an accident, came into the hospital, and just like had broken bones, but for whatever reason, their respiratory drive, they can't maintain that on their own, so they have to be on the ventilator. Well, you've got to feed them.
Yeah.
But all they had was broken bones, so their gut works. So we just place a tube, usually either in their mouth down to their stomach or through their nose down to their stomach, and feed them that way. Feed them with tube feedings. Sometimes, if people, as you age, or as you if you have throat cancer, some patients with throat cancer, after they have surgery, they can still walk around and be fine, but their swallowing mechanism doesn't work anymore.
Yeah.
So they have to have a tube directly inserted into their abdomen, into their stomach, so that they can be fed. And you can do that. I have patients that, that's what we call bolus feeding. So basically they just pour in a certain amount of feeding, flush it with water, close the tube back, and go on about their day. I know it sounds weird,
but
it sounds weird, but I have patients that are, what do you do when you're like fully ambulatory, but you're cut off from being able to take anything by mouth, but you've got to have nutrition, so
you gotta do what you gotta do.
Yep.
And I know you said earlier that you still need to constantly be updated in schooling.
Yep.
What kind of certifications or schooling did you need before you could get into the field?
So I have a 4-year degree. I have a bachelor's of science in my 4-year degree is in nutrition and dietetics. And then I had to get into an internship, which is a 9-month internship after you get your 4-year degree.
Paid or not paid?
Not paid.
Not paid.
Most of the time you have to pay for it.
Yeah.
So, yeah, we don't like that for us. But we're not the only field that has that. And then we take our registration exam. And then once you take your registration exam, as long as you keep up with, because we have the Commission on Dietetic Registration, if you maintain your certification with them, as far as, and because they require you, so we're required to do continuing education from CDR, but we're also required to do continuing education with the state for your licensure. So Georgia is one of those states that you don't only have to be registered, you also have to be licensed. So some states don't require you to be licensed, but you are required to be registered. So like if I transferred to one of those states, then I could go automatically to work. If I needed to transfer my licensure or get additional licensure, it's basically just the state of Georgia communicates with them, tells them that I'm active in my license, and then they issue me a license.
Okay.
But yeah, so you can also, for the nutrition career, you can also we have people that have a 4-year degree in something else, not nutrition related, and get their master's in nutrition, and then do an internship, and then take their registration exam. So it just kind of depends on like the path that you want. Some people, not everybody, and this is, I'm a big proponent of, not everybody that goes to college and gets their first college degree knows what they want to do coming straight out of that degree. Some people you can get, like if you got a Bachelor of Arts and then got a master's in nutrition, then you could become a dietitian. It just depends on what you want to do. I've worked with multiple dietitians who have gone back to school not my thing. Gone back to school to either be a physician's assistant, or even I know several of my dietitian friends who are actually in medical school right now. Not for me. No thanks.
Yeah.
I'm not that. Nothing against school, but that's just not my thing.
No, I mean, I got no complaints here.
But I mean, if that's what you want to do, then go for it.
Yeah. So, and it's funny that you say that, because I was just reading something in the same class.
Mm-hmm.
Somebody had said that they're in this course and they're about 40, 50 years old, and they're saying that they've done this career that they're in right now, and they're trying to branch out. That's why they're in school.
Mm-hmm.
But they've been in this career that they're doing for so long, and now after taking this class, they think that social work, working with others, doing whatever,
Yeah.
might be for them.
Yeah, and
You
I've
just never, I mean,
and I've known because I used to work at another hospital that has their own internship program, and I was on the committee to select interns for that internship program. And there were several applicants there who it was their second career. Not everybody, I mean, you could go into something else and do it for 10 or 15 years and then be like, you know what, I think I want to change gears.
Oh, yeah.
And, totally do that. I've seen, people that go into nursing after, doing, like, being in the business world for, 10 or 15 years and just want to do that instead. And I think that's great, do whatever makes you happy.
something different at a
Yeah,
certain point.
don't spend your life in a career that you don't love.
Yep. Exactly. What are some of your hobbies and interests outside of work?
Outside
Does
of work.
anything kind of correlate, or?
No, I pretty much turn my nutrition brain off when I leave work, only because I don't give nutrition advice for free, because I have
Because you get
been
paid
in this
for it.
career a
You
long time.
You get paid to not give it for
I've been
free,
in this career for a long time, and I've had friends say, hey, could you do me a meal plan? And I'm like, yeah, sure. My going rate for outpatient services is $50 an hour. And they're like, wait, what? And I'm like, I could print you off some information, but if you're going to want me to explain it to you or like put in work using my career, you wouldn't do the same thing to somebody who does financial planning for a living. You don't, see those people at a party and go, hey, can you adjust my portfolio, or can we talk? Like, you don't do that.
To anyone.
So like when I go, it's funny that you say that, because like when I go to events and stuff, I'm hesitant to tell people what I do, because if they have food on their plate, they're like, they automatically guard their plates. And I'm like, look, you're not paying me to tell you that what you're about to put in your mouth is not good for you, so we're good.
Yeah. I'm not,
We are so good. But I love spending time with my families, with my family. I'm active in church, and I love to read. Yeah. I even love to, I want to learn to crochet here pretty soon, so yeah.
That would be nice. What motivates you to do what you do?
The patients, and the teams that I work with. I work with a wonderful group of other dietitians, but just being able to, helping people is what really motivates me. I play a very small part in a patient's care, in a patient's daily care, but I see the other team members that put into that patient. So when patients are in the ICU for a while and then they come back and visit us after they're well, that's my favorite.
Yeah.
It's my favorite.
I can imagine.
Yeah.
And
It's really great to see them.
And like you said, it's not just you've got skin in the game.
Yeah.
But like you said, you get to see everybody.
Yeah,
that
because in my
works and-
ICU, we fully do the team approach. Like, we have multidisciplinary rounds. So, like, everybody, and the healthcare is getting better about realizing that everybody makes a difference in a patient's length of stay.
Are you CPR and first aid certified?
I was. I'm not currently. In my job, some other hospitals require their dietitians to be. My hospital does not. And there's, of course, two different certifications there for that. There's like basic life support, which is like somebody off the street would be like basic life support.
Yeah.
And then there's what like nurses have to be certified as. So there's basic life support, and then there's like the nursing and physician certification. But I was certified, but that was my personal choice, not because I had to do it for my job. I've never had to be CPR certified for my career.
Are there different steps or different ways that you would go about trying to resuscitate someone that's older? No, I didn't think so. But
Nope. It's all about the airways. It's all about the ABCs. It's about the airway, breathing, cardiac. All about it. Yeah, it doesn't matter. The only thing that age plays into is, do they have any conditions that caused the car? Yeah.
Yeah. What are long-term career goals that you have?
I used to think that I wanted to do management, and then I did management for a half a hot second. No, thanks. The management in hospitals is just like, business management. It's very political, and I don't play those games very well. So I would say, just to basically be the best practitioner that I can be, maintain my skills. I love doing ICU care. I don't think that I would ever give up ICU care. If the only change I can think of that I would want to make is if either of the dietitians that I work with currently that cover the medical ICU, which is more a little bit of everything, or the surgical trauma ICU, I would want to cover one of those instead of the neuro. But other than that, I'm good where I'm at.
That's good though.
Yeah.
You want to be the best at what you do.
Yeah.
No matter what, right?
Yeah. I want to provide, the best care that I can for the patients and their families, and that's, but we also, something that I would like to learn more about, we also, because I didn't do it at my two previous hospitals I've worked at, we have a children's hospital attached in Macon. So I would like to learn, and I don't know a ton, because we're not taught in our internships unless you have, like, as far as kids go, you have a rotation in a children's hospital, but it's 2 weeks, and you have class on Mondays, so it's literally 8 days. So it's not a lot of time to learn like the children's formulas. There's different, you have to plot them on the growth chart instead of doing like calories per kilogram like we do for adults, or it's different formulas that you use for children. So and our children's dietitian she is semi-retired, so we're all like picking her brain.
Yeah.
So we all pick her brain all the time, and every once in a while I'll go over to children's with her and like let me do like the full assessment so that I can just like sharpen those skills.
Yeah.
So
Trying to pick her brain, get
Yeah.
some info while she's going out.
Yeah, because she, like I know the formulas for the adults, she knows the formulas for the kids like backwards and forwards. Like she can tell you, oh, well, that kid's got this going on, so like this formula would be better for them than this. Whereas I can do that for adults, she can do that for the kids. So like just picking her brain on those kind of things, those little nuanced things about, well, what formulas do we carry? Like, can we get others? So those type of things. So yeah.
How do you, if you do at all, involve family members in the care process or keep them informed?
Yeah, so in the ICU, it's easier because most of the time ICU rounds are at a certain time every day. So families get to, like, once they get initiated into ICU life, we tell them, the nurses tell them, like, here's what time rounds are. If you want to participate, they can listen to, we usually have nurse practitioners or physician's assistants that are helping the attending out. So they can listen to rounds. I chime in on my part if the patient's on tube feeding or if they're on a diet or, like learning whether they're eating well. So that's kind of when I find out my information that I need to know too. But it's a little harder on the medical floors because doctors don't always round at a certain time. There's more consultants. So there you have an attending physician, but then you may have a consultant if the patient has kidney issues or if the patient has liver issues or if the patient has GI issues, and all those physicians are going to round at different times. So unfortunately, a lot of that falls on the nurses to try to, the family members are calling. So the nurses are really good about telling families, like, hey, you need to appoint a point person to call, and then you're going to have to disseminate the information because the nurses are, on the medical floors, the nurses have 5 or 6 patients.
Yeah.
So it's really hard if you've got 10 family members calling about your 6 patients. That's 60 phone calls, and no, that's too. And nurses have enough to do.
You could even get 10 phone calls about one.
Yeah, nurses have enough to do. And I'm always looking for ways to, like, help the nurses out as far as when what I do bleeds over into them. So, like, if I need to change the tube feeding formula, then I will go to the supply closet and get them the supplies. So, like, I'll get the bottle of formula for them, get the tubing change, and set it, like, at their station and be like, hey, next time you go in there, if you'll just change out the formula.
Yeah.
So, like, those little things, or, the nurses will call, or we have this wonderful thing through the computer system that we use where you can send a chat message. Best thing ever. It's like sending a text message. But the nurses can chat you and say, like, hey, this person isn't eating, they're not getting a supplement, could you order them a supplement? Absolutely.
Yeah.
So, just kind of doing those things to try to, and I'm always, the committees that I am on, whenever somebody pipes up and says, well, we can ask nursing to do that, I'm always like, no, don't add to their task list. They already have enough to do. Like, leave them be. Find a way to take off their task list instead of adding to it, please.
Yeah, if you can take off,
Yeah.
it's better than adding.
Yeah, or if you can combine some things, then yes, do that, please.
Yeah. Are you a patient and understanding communicator?
Yes.
Yes.
Not always, but most of the time. I think you develop that because I would say when I started in my career, I wasn't a very patient person to begin with. But I think as you learn, as you grow, and as you mature, you deal with so many different types of personalities that you kind of have to let that stuff go off of you like water off a duck's back. Like, you just have to, like, say to yourself, like, let's say that, I've had physicians dress me down in the hallway in front of staff and in front of, like, patients' families and stuff walking by, and that's very hard to get over. But I had one physician do it during rounds one day, and lucky for me, I was able to just, like, let it go in the moment, because that would not have been me when I was younger. I would have probably dressed him down the same way he did me, but I let it go. And then later, after rounds, I pulled him aside and I said, like, do you do you want the dietitian presence during rounds when it's your week to be the attending?
Yeah.
And he was like, yes, I love your input. I said, well, you didn't show that at rounds today.
No.
You embarrassed me in front of the whole entire team. So if you want me here, I'm going to need you to please don't do that again.
And that just, yeah.
Like, because basically I told him I won't be nice next time.
Yeah. And that shows, like you said, a lot of maturity. Just the fact that you would even say, let me bite my tongue and pull them off to the side. And even if you pull them off to the side, you didn't chew them a new.
No.
You just said.
Well, and you have to remember too that like the way that you react to things says more about you than it does about the other person.
Mm-hmm.
So you may think, well, he yelled at me, so I'm going to yell back at him.
Yeah.
But that doesn't say, that says more about your character than it does the other person's. So I just try to remind myself of that. If I do ever, somebody gets angry with me, I'm like, don't, keep your lips closed.
Mm-hmm.
Don't say it. Because even though they would deserve it, it says more about me if I just stay quiet and address it, like calm down and address it later, than it would if, like we get into a brawl right here in the hallway. That's not professional, would not be a good look. And I might lose my job, so not a good.
In the moment, you think so much about, they just embarrassed me or whatever,
Yes.
this much. But then if
Absolutely.
you react, you're going to embarrass yourself 10 times more than they already did.
Absolutely.
So,
So you have to remember, like,
where you're at, what's going on,
Yeah.
the options you can take, all of that.
all that.
Is there anything else that you would like for us to know?
No. I think we covered it.
Yeah, that was good. Awesome. Thank you.
You're welcome.
Give me a hug. Please.